must go out of the way and go. You must. The incidence of smoking in doctors has come down, but it is not nearly. Then the other is body weight. Not to be overweight, not to be obese. How many of you check your weight frequently? How many of you know your BMI? Oh, good actually. Many of you are doing well. So not to be overweight is fundamental. Earlier days is to be well, but now we know to be obese, obesity, fat is inflammatory. So fat, overweight and fat is not only a cause for cardiovascular illness today, it is a cause for all sorts of illnesses all over the body, not only diabetes, even cancer. So in other words, not to be overweight is fundamental. Please don't feel bad about some of you are overweight, but to start doing something about it. It's never too late. Then the health factors are, say, lipids, or cholesterol, blood pressure, blood sugar. Not to be, there is some moderation in the way cholesterol is being treated today, suggested today by Andhrapradesh. Earlier, it used to be thought that the lowest level of cholesterol is the best. The lower the level of LDL, the better. But we know cholesterol is also essential for body's own health. People say cholesterol is essential for particularly our proper function of the brain and rest of the nervous system and hematologically and otherwise. So too low a cholesterol is not needed, but too high is risky. That should be kept in mind. Hello. Next, blood pressure. How many of you took your blood pressures on and off? A lot of doctors never don't take their blood pressures. Is it true or not true? I know of even cardiologists who never took their blood pressures. And first time they come with some problem or the other themselves and it happens. It's not untrue, it happens. So in other words, adequate, not only taking blood pressure, if you look at, if you go to a hospital, even high-end tertiary care hospitals today, who takes your blood pressure? The nurse or nurse in training generally takes the blood pressure, doctor doesn't take the blood pressure. Then most of the time it's not properly recorded, both in inpatients as well as outpatients. The doctor doesn't take the blood pressure themselves. They don't teach their colleagues to take blood pressure carefully and how it should be properly taken and also proper, I won't go into those details today except telling you properly taken home blood pressure is more reliable than what is done in the hospital, not only because of the white coat, this one, but also it is not properly taken. That's, just keep it in mind. And keep checking your blood pressures at least once a month. Ideally, if you are on treatment, every week. And if you are my age, you must check your blood pressures daily. What is the reason why elderly people, we should take their blood pressures or we should check our blood pressures almost daily? The reason is after 55 years of age, our diastolic pressure goes on coming down. 55 years or later, the diastolic pressure goes on coming down. Then it goes to the level of 70s or even less. Systolic pressure goes up because of arterial stiffness. Then to the extent, when they go to hospital, systolic pressures are even more. The physician or cardiologist or practitioner, whoever it is, starts giving them some antihypertensive medication, and then the blood pressure is 160, 170, diastolic is 70. And diastolic, systolic blood pressure comes down, and diastolic pressure also comes down to less than 70. When diastolic pressures come down to less than 70, you know the danger? It is the diastolic pressure which is the perfusion pressure to all organs, including the heart. So people elderly already have vascular disease of some kind. Not only the heart, the brain, kidneys, etc. And they start having symptoms related to this, or even precipitate a myocardial infarction or a stroke. This is not uncommon. And carefully take the blood pressures. One of the common mistakes is, the way we are trained is, we just check the blood pressure, the systolic, we don't even hear below 80. We take out the stethoscope at 80, don't bother to take it down. So diastolic hypotension is risky and dangerous. And I won't try to finish off my talk. When time is up, please tell me, I will hold on. Maybe some other time we will meet, because I have to tell you some of those things. Then another thing that happens, if you are treating an elderly person or you are elderly yourself, the patient comes to a practitioner, a physician or a practitioner or a cardiologist, elderly, 70s, and I treat his systolic blood pressure. I don't particularly take care of his diastolic component, it's now 140, but diastolic is 60. This person also has symptoms of prostatic hypertrophy. He goes to Dr. Chari or one of urologists, and what do they prescribe? An alpha block. And the patient goes home, he may not meet the physician that he is prescribed this drug, goes home and takes this medication, and they give it in the evening. Is it true? So that nocturnal urinary symptoms are less. Then he goes home, his blood pressure falls down to less than 100, 110, diastolic is 60 or less. He gets up in the night and goes and falls down in the bathroom, had a hip fracture, and then the end of the game. Is it true or not true? Uncommon or common? So in other words, educate your patients to be careful about this. Always insist upon they telling you whatever drugs anyone prescribes, they must inform the treating physician or a practitioner or a cardiologist. The rest of the things, these are how you deal with yourself and your family, your children. And nuclear family is the norm now. And then we used to live generations together earlier. Now, if you are older enough, nobody else lives with you. You are alone. And loneliness kills. You should realize this. So that's the reason why you need friendships. And I won't go into all those details except telling you, I'll enumerate some of these. Continue to have friendships, where you can communicate, meet together often, as much as possible. And thanks to COVID, friendship slowly disappeared. We hardly meet each other, and it's only by WhatsApp people communicate with each other. And the greatest friend for most of the people today is mobile phone, and not real human friends actually. Now you should have a sense of humor, and should be willing to laugh. How many of, some of us, I won't bother you with this question except telling you, we know some doctors who never laugh. Is it true or not true? There is a important component of humor. Even our patients also need to be humored. It's important. Actually, our 1963 batch, when we met together first time more than a decade ago, they asked me to give a talk on cardiology. Then I told them I won't give you a talk on cardiology, but I will give you a talk on humor in medicine. And then, because Dr. Subramani is here, You are there in college, some of you, and most of the time we were not good students. And Subramanian was slightly better student than me. And most of the time we spent with friendships, moving about, playing games, etc. And not a single dull moment in life. So in other words, cultivate a sense of humor, and it is very, very important. Loneliness I have already mentioned. And also where we live, your neighborhood, their attitudes and their negativity, positivity, all those things will affect you. Some of us in our practices never knew who were our neighbors. Is it common or not common now? So that's the problem also. Then many people try to think, those of us who try to give lectures as to how to conduct yourself, value systems, character strengths and professionalism, say, don't bother about money and money comes automatically. It's not true. It doesn't come automatically. You have to earn your money. And money got its bad name because of some of the business practices, the political system, and also some of us the way we practice. So money should be considered as an essential component of our lives. You have to have enough money. It's like it's part of our healthy life. So I won't go into details. Maybe another time we'll talk about it, how it can be handled. And choose the right institution and practice platform. Some people choose the right institution and platform means don't get stuck. If the institution you are working, the methods you are practicing are not suiting you, be willing to change. And if you ask me, some people criticize me for going on changing institutions. Right from, say, here, Guntur to Chandigarh, Chandigarh to Usmania and other places. And I changed almost around 8 institutions until now. So it is something like I am a square peg in a round hole. I am not fitting in most of the places. But be willing to go on. What you want to do, don't give up on it. Then the other is retirement. What is the right time to retire? One of you can just speak loudly. That's actually what is the right time to retire? No. So now a lot of youngsters try to think, and they are copying the software engineers and business. They are trying to retire around 40s and 50s, and then they will suffer with lack of direction and purpose in life. People are living not only longer, but also healthily so. You are healthy and living longer. You have not just 2 phases in life, you have 3 phases in life. Try to do something different. Suppose you reach the 60s and above. Don't try to think you have no work to do. Don't try to think you don't make any difference. There is a recent study done by Harvard Business School, it published it also, that an institution which has only youngsters versus an institution with only older people, neither of them did well. But an institution which had a combination, they were doing better. The reason is the seniors with their experience and wisdom guide the juniors. And they also mentor, teach and guide them in difficult situations. So that's the reason why those of us who are getting older still have a role. So then, be willing to ask at some point, what is it you want to be remembered for? For some of us, at my age, it may be too late. But for some of you, most of you, it's never too late. Be willing to ask, what do you want to be remembered for? I'll leave it here, open it for discussion. Please take over.
Sir, as far as cholesterol level is, you are telling very low is not good, but the cardiovascular risk factor concern is as low as is better, particularly when you have cardiovascular disease. What is your comment, sir?
The cholesterol concept, right, last more than 70 years, there is a continuing emphasis on the lower the LDL cholesterol, the better. And statins came into the market. And what is important to realize is that cholesterol, just like look at cholesterol as an essential component of the body. Do you agree? For our neurological wellness and hematological wellness, rest of the body, liver, etc., we need cholesterol adequately. Everybody agrees. And then, say just like blood sugar. Blood sugar normal is good, but hyperglycemia is not good. Even hypoglycemia is good. Same principle applies to cholesterol. The LDL cholesterol, when it is low, now shown long-standing use of statins results in can lead to diabetes. And long-standing use of lowering of cholesterol to less than unphysiological levels also results in cognitive abnormalities, and even Alzheimer's disease is considered as one of the risk factors for it. The recently, now the American Heart Association revised its advice, saying that lowest level of cholesterol is not the ideal. You try to maintain it to physiological levels, and otherwise a healthy person, less 130 or so is quite all right. If it is more than 160, it is high. And don't try to lower it to lowest levels as is suggested by the pharmaceutical industry. Sponsored studies. They are called sponsored studies. Recently I saw a patient who is around less than 60. For the last 10 years or more, he had a bypass surgery done, and his cholesterol, LDL cholesterol is 54. And he also has diagnosed of Alzheimer's disease. And whether this lower cholesterol is responsible for it, I won't be able to say in that patient, but it is clearly shown now, not only muscular problems and etc., but cognitive dysfunction, memory, etc., are negatively affected by lowest level of cholesterol. American Heart Association now came out with a suggestion. It's not essential to reduce it to lowest levels. Thank you.
Thank you very much, sir, Professor Somaraju, sir. We are very much enlightened with your experience and philosophy about how a person, a doctor should live his life. I think the last two comments you made were very caught my brain. Is when you should retire. And personally, I speak that you have no time of retirement. As long as you are alert mentally and partly physically, you are able to deliver your goods. You must serve the patients. And then what you should be remembered for is the very bright comment that you made, that we must work hard in our life so that when we are no more, what they should remember about us, that impact you have to make on the society. Thank you very much for your two comments.
Retirement, I just want to say something. Retirement is retire like Kalam. You know how he died? While giving a lecture to students. So that's why you can retire. Thank you.
Very right, sir. Thank you very much.
Thank you. I request chairpersons to come and join for felicitation of Dr. B. Somaraju, sir.
మీకు వచ్చిన అమోఘమైన రక్తంలో నా ప్రతి పాపము కడిగి పవిత్రపరిచినారు. నిర్జీవ క్రియలు విడిచి
To come on the dais to felicitate our chairpersons. Sir, please chairperson, please. Sir.
Now next, session 2, liver, the Pandora box. For this, I would like to welcome chairpersons Dr. Padma Shri ma'am and Dr. Surya Narayana sir. On to the dais. Thank you. Please take your chairs. Our speaker, Dr. B. Rajesh sir, on the topic incidentally detected gallstones or polyps. When to chairpersons to introduce Dr. Rajesh sir. Dr. Rajesh Matani sir, current placement is consultant medical gastroenterologist, Manipal Hospitals, Vijayawada. Previous placements are Associate Professor, Department of Medical Gastroenterology, NRN Medical College and Hospital, Mangalgiri, Andhrapradesh, Aster Ramesh Hospital, Guntur and Vijayawada. 1 year advanced endoscopy fellowship at Baldosa Institute of Digestive Sciences, Global Hospital, DM Med Gastroenterology from Vaideni Institute of Medical Sciences, Bangalore, 2014. Areas of interest is endoscopic, ultrasound guided interventions and third space endoscopy.
Thank you, organizers, for giving me this opportunity. This is a incidentally detected gallstones and polyps we commonly seen in our clinical practice. Incidence of gallstones is overall is around 6%, but it varies as the age progresses. It becomes 20%. Especially in women who are more than 50 years of age, the prevalence is around 20%. And the women are more predisposed to having gallstones than male people because of hormonal influences. Based on chemical composition, macroscopic appearances, the gallstones are divided into cholesterol, pigment, and red stones. Cholesterol stones are most common, that is 75%, and the risk factors is a common saying like fatty, fertile female of 40s. Because of obesity, obesity causes increased saturation of the cholesterol in the bile, and there is a relative decrease in the bile acids and phospholipids, which are anti-inflammatory.
ఈ రోజుకి ఫస్ట్ సెషన్ ముగిసింది, సెకండ్ సెషన్ స్టార్ట్ అయింది. ఆల్మోస్ట్ కంప్లీట్. సెకండ్ సెషన్లో ఓన్లీ కొత్త వారి పరిచయాలు, ఈ 3 రోజుల సెషన్లో ఆల్మోస్ట్ చాలా చాలా ఇంపార్టెంట్ టాపిక్స్ రీసెర్చ్ చేయడం జరిగింది. ప్రతి డిసీజ్ అంటే క్యూర్ కానీ దీర్ఘకాలిక వ్యాధులు, అలాగే గుర్తించలేని సివియర్ కేసులు, ఇలాంటివన్నీ కూడా డిస్కస్ చేయడం జరిగింది 3 రోజుల్లో. అవన్నీ కూడా మన ఛానల్లో ఉన్నాయి, చూడండి ఒకసారి. నిజంగా చాలా ఉపయోగపడతాయి. అవసరం వచ్చినప్పుడు రెఫరెన్స్కి మాత్రం అద్భుతంగా పనికి వస్తే ఒకసారి చూడొచ్చు మన ఛానల్లో. థ్యాంక్ యూ. మళ్ళీ